Hello and welcome to the COMLEX Instant Review. Let's talk about celiac disease. Keep in mind here that it's a genetically predisposed disease. Patients have a permanent sensitivity to gluten, which develops after dietary exposure to gluten, which is, by the way, contained in wheat, rye, or barley. So, wheat, rye, or barley are not recommended now for patients with celiac disease. What happens here is that the activity actually resides in the gliadin fraction, and trans glutaminase is the component that actually reacts with the gliadin fraction, inducing a sensitization of the lamina propria to T cells. And if the T cells are not going to do their job, then there's going to be villous atrophy and crypt hyperplasia that's going to develop. So keywords, T cells are going to be sensitized, tissue transglutaminase, and gliadin fraction, wheat, rye, or barley. All those are key points for celiac disease. A toddler comes in with pale, loose, offensive diarrhea, okay, and abdominal distension, failure to thrive, and decreased appetite. They have depression and apathy, and patients have hypotonia, weakness, and ataxia as well. What is the best initial test? Well, anti-tissue transglutaminase IgA. Again, anti-tissue transglutaminase IgA is the key test you want to remember. Keep in mind that patients may need a biopsy for the small bowel as a definitive test, and the treatment is lifelong exclusion of gluten as the main choice for treating celiac disease. And another condition we want to talk about are the enzyme deficiencies. Let's review disaccharidase deficiencies, and remember they can be either due to a genetic disorder or secondary damage of the small bowel. Keep in mind that congenital lactase deficiency is rare, and symptoms occur with exposure to lactose on milk. So lactose intolerance with ingestion of milk, you're going to think about disaccharidase deficiency. Also, most of the patients have an adult type due to physiological decline in lactase that's gradual in onset, and it's not as acute in presentation. That was a board review for celiac disease and the pediatric boards on the COMLEX and USMLE board exam. Please visit COMLEXFlashcards.com. That's COMLEXFlashcards.com for daily updates on how to prepare for the COMLEX and USMLE board exam, as well as getting through medical school.